Let me tell you about a man named Robert. 72 years old. Retired engineer. Sharp, active, proud of the fact that he never missed a doctor's appointment. He was the kind of man who kept a spreadsheet of his own blood pressure readings. Then one afternoon, his physician called him with lab results that stopped him cold. His kidneys were failing. Not slowly declining. Failing. Stage 3 chronic kidney disease, creeping towards stage 4. And the most devastating part of that phone call wasn't the diagnosis. It was what came next. His doctor quietly admitted that the damage had likely been building for years. Silently. Invisibly. While Robert did everything he was told. He took his medications every single morning without missing a dose. He was a model patient. And that's exactly what destroyed his kidneys. I'm Dr. Senior. And what I'm about to share with you in the next few minutes could be the most important thing you hear all year, especially if you're over 60 and you take any daily medication at all. Today we're going through the 8 most common medications that are silently damaging your kidneys right now. Ranked from the ones most people overlook all the way to the combination at number 1 that most doctors never warn their patients about. Stay with me through every single number because number 1 isn't what most people expect. And it's the most dangerous situation happening to millions of older adults across this country right now. Before we begin, let me be absolutely clear. Do not stop any medication without talking to your doctor first. That's not what this is about. This is about giving you the knowledge to ask better questions, advocate for yourself, and protect the organs that are quietly keeping you alive. Because here's the truth nobody puts on a prescription label. Your kidneys filter over 200 liters of blood every single day. They regulate your blood pressure, balance your electrolytes, remove waste from every cell in your body. And after 60, their filtering capacity is already naturally declining. Add the wrong medications into that equation and the damage doesn't announce itself. There's no pain. No obvious warning. Just a number on a lab test that one day comes back wrong. Let's get into it. Number 8, Ibuprofen and common NSAIDs. I want to start here because this one lives in nearly every medicine cabinet in America, and almost nobody thinks of it as dangerous. Ibuprofen. Advil. Motrin. Naproxen. Aleve. These are the pills people grab for a sore back, a stiff knee, a headache that won't quit. They're sold without a prescription. They feel harmless. They feel like the opposite of a big deal. Here's what they're actually doing inside your body. NSAIDs work by blocking certain inflammatory chemicals. But those same chemicals play a critical role in regulating blood flow to your kidneys. When you block them with ibuprofen, you're essentially constricting the blood vessels that feed your kidneys. Less blood flow means less filtration. Less filtration means waste starts building up in places it shouldn't. In a young, healthy body, an occasional ibuprofen causes minimal lasting harm. But after 60, kidney reserve is already reduced. The margin for error shrinks dramatically. A major analysis published in the American Journal of Kidney Diseases found that regular NSAID use in adults over 65 nearly doubled the risk of acute kidney injury. And acute kidney injury isn't just a temporary problem. Each episode leaves scar tissue behind. Permanent damage accumulates quietly over time. The alternative acetaminophen, Tylenol, is significantly safer for kidneys when used at appropriate doses. For inflammation, talk to your doctor about topical anti-inflammatory gels, which deliver localized relief without systemic kidney exposure. Number 7, proton pump inhibitors. You heard about these in another context recently. But here's what most people don't know about the heartburn pill they've been taking every morning for the last several years. PPIs omeprazole, pantoprazole, esomeprazole can trigger a condition called interstitial nephritis. That's an inflammation deep inside the kidney tissue itself. And the terrifying part, it's silent. It produces no symptoms you'd notice. No pain. No swelling. Nothing that would make you pick up the phone and call your doctor. A landmark study in the Journal of the American Society of Nephrology followed over 170,000 patients and found that PPI users had a 28% higher risk of developing chronic kidney disease and a 96% higher risk of kidney failure compared to non-users. Nearly double the risk of kidney failure from an acid reflux pill. The researchers also found something that should alarm anyone taking these medications long-term. The damage was dose-dependent and time-dependent. The longer you took them, the worse the outcome. If you've been on a PPI for more than 3 months without anyone re-evaluating whether you still need it, that conversation is overdue. Ask about H2 blockers as a safer bridge while you work on dietary changes. Number 6. Common antibiotics. Not all antibiotics are equal when it comes to your kidneys. But several of the most widely prescribed ones carry real nephrotoxic risk, especially in older adults. Aminoglycosides like gentamicin. Sulfonamides like trimethoprim sulfamethoxazole, commonly prescribed for urinary tract infections. And fluoroquinolones like ciprofloxacin. Here's the problem. UTIs are extremely common in adults over 60, especially in women. That means repeated antibiotic courses and repeated exposure to nephrotoxic antibiotics compounds the damage with every round. Research published in the Clinical Journal of the American Society of Nephrology showed that older adults receiving nephrotoxic antibiotics in outpatient settings had significantly elevated rates of acute kidney injury within 30 days of the prescription, with higher risk in those already showing early signs of reduced kidney function. The critical takeaway here isn't to avoid antibiotics when you genuinely need them. It's to make sure your doctor is aware of your kidney function before choosing which antibiotic to prescribe. Simple adjustments in drug selection can protect your kidneys without compromising treatment. If you're finding this genuinely valuable, drop a comment below and tell me what medications you're currently managing. Your experience could help someone else watching this today. Number 5. ACE inhibitors and ARBs. This one is going to surprise a lot of people, and I want to handle it carefully. ACE inhibitors lisinopril, enalapril, and ARBs losartan, valsartan are among the most commonly prescribed medications for high blood pressure and heart failure. And for most patients, they're genuinely beneficial. Here's the nuance that many patients are never told. These medications lower blood pressure by relaxing and dilating blood vessels throughout the body, including the vessels inside your kidneys. In patients with already compromised kidney function, or in situations of dehydration, or when combined with NSAIDs or diuretics, that dilation can drop kidney filtration pressure below the threshold required for safe function. The result is a sharp, sudden spike in creatinine levels, a waste product that accumulates when the kidneys can't filter properly. Studies show that up to 30% of older adults started on ACE inhibitors experience a meaningful rise in creatinine within the first few weeks. Most doctors do monitor for this. But the monitoring doesn't always happen as consistently in real-world practice as it should. The message isn't to fear these medications. It's to make sure your kidney function is being tested regularly, especially in the first 3 months after starting or increasing the dose. And if you're also taking NSAIDs, you need to know that combination carries a specific and documented danger. Number 4. Diuretics. Water pills. Furosemide. Hydrochlorothiazide. These are the medications that help your body shed excess fluid, and they're prescribed constantly for high blood pressure, heart failure, and swelling. Here's what happens when the balance tips wrong. Diuretics pull fluid from your bloodstream. That's the intended effect. But when too much fluid is removed too quickly, or when an older adult isn't drinking enough to compensate, the kidneys suddenly find themselves trying to filter blood from a tank that's running dangerously low. This is called volume depletion. And it's one of the most common preventable causes of acute kidney injury in adults over 65. A study in the Journal of General Internal Medicine found that diuretic-associated kidney injury accounted for a striking proportion of hospitalizations in older adults, and that many of those hospitalizations followed relatively minor events like a hot day, a stomach bug, or simply forgetting to drink enough water. Here's what you need to do. If you're on a diuretic, your hydration is not optional. And if you experience any illness that reduces your fluid intake, vomiting, diarrhea, fever, contact your doctor immediately about temporarily adjusting your dose. What was the right dose on a normal day may be dangerous on a sick day. Number 3. Calcineurin inhibitors and immunosuppressants. This one is more specialized, but it affects more people than most realize. Cyclosporin and tacrolimus are used in transplant patients to prevent organ rejection. But they're also prescribed for autoimmune conditions: rheumatoid arthritis, psoriasis, inflammatory bowel disease. These medications are directly nephrotoxic. That means kidney damage isn't a rare side effect. It's a predictable consequence of long-term use that requires careful monitoring to manage. The mechanism is straightforward and brutal. These drugs cause sustained constriction of the blood vessels that feed the kidney filters. Over time, that chronic constriction causes fibrosis, scarring inside the kidney tissue itself. Research shows that up to 20% of patients on long-term cyclosporin therapy develop clinically significant chronic kidney disease as a direct result of the medication. If you or someone you love is on an immunosuppressant for any reason, kidney function monitoring should be happening at least every 3 to 6 months. If it isn't, ask why not. Number 2. Contrast dye used in imaging scans. This one catches people completely off guard because it doesn't come in a pill bottle. If you've ever had a CT scan with contrast, an angiogram, or certain cardiac procedures, a chemical called iodinated contrast dye was injected into your bloodstream to make the images clearer. That dye is filtered almost entirely by your kidneys. In healthy, younger kidneys, this is generally manageable. In kidneys already working at reduced capacity, which describes a significant percentage of adults over 60, contrast dye can trigger what's called contrast-induced nephropathy. A rapid, sometimes permanent decline in kidney function. A meta-analysis published in Radiology found that patients over 65 with pre-existing mild kidney impairment had a substantially elevated risk of acute kidney injury following contrast imaging, with a notable percentage requiring dialysis support afterward. Here's what you need to do before any imaging procedure. Tell your doctor your most recent creatinine and GFR numbers. Ask whether contrast is absolutely necessary for what they're trying to see. Ask whether you'll receive hydration before and after the procedure to protect your kidneys. These are not unreasonable questions. They are standard protective steps that should be offered routinely and often aren't. Number 1. Medication overload and polypharmacy. I told you at the beginning that number 1 wasn't going to be a single drug. And here's why that matters more than anything else I've said today. Every medication on this list, taken alone, presents a manageable risk in the right patient, with the right monitoring, at the right dose. Doctors know this. That's why they prescribe them. The catastrophic problem is what happens when an older adult is taking multiple medications simultaneously, each prescribed by a different specialist, each appropriate in isolation, none of them ever evaluated together as a complete picture. The average American over 65 takes 5 or more prescription medications daily. Many take 8, 10, or 12. And within those combinations, there are interactions, additive toxicities, and compounding burdens on kidney filtration that no single prescribing physician has fully mapped out. Think about what that looks like in real life. A 71-year-old man takes lisinopril for blood pressure. He takes a daily ibuprofen for his arthritic knee. He was recently started on a diuretic for mild fluid retention. He had a CT scan last month with contrast dye. He takes omeprazole every morning for reflux. Each of those decisions, made independently, seemed reasonable. Together, they may represent a perfect storm of kidney toxicity. The NSAIDs are restricting blood flow. The ACE inhibitor is lowering filtration pressure. The diuretic is reducing fluid volume. The contrast dye added an acute hit to already stressed tissue. And the PPI is contributing background inflammation. No one doctor looked at all of this together. No one ran a combined kidney risk assessment. And Robert, the man I told you about at the very beginning of this video, he never knew. Until the damage was already done. This is polypharmacy. And it is the most silent, most underreported, most preventable driver of kidney failure in older adults today. So here is what I need you to do. Write down every single medication you take. Every prescription. Every over-the-counter pill. Every supplement. Then book an appointment not for a specific complaint, but specifically to review your full medication list in the context of your kidney health. Ask your doctor for a GFR test if you haven't had one recently. GFR, glomerular filtration rate, is the most accurate measure of how well your kidneys are currently functioning. It's a simple blood test. It can tell you things your body never will. Because your kidneys don't send warning signals when they're struggling. They just quietly keep working until one day, they can't. Robert got his wake-up call in time to make changes. Not everyone does. Don't wait for a phone call that changes everything. The information is right here. The next step is yours. If this video helped you or someone you love, share it today. The person who needs this most probably doesn't know they need it yet.